morning, everybody. I'm Dr. Gayatri, Assistant Professor in the Department of Pediatrics, and today's topic will be about developmental assessment in children. So, developmental assessment, as you know, it forms one of the baseline foundations in pediatrics. So, without knowing about normal growth and development in children, it is very hard for us to do other assessments also. So, for whatever condition, for whatever disease a child comes to you for, evaluation or treatment, looking at the child's development forms part and parcel of our treatment and evaluation. So, let us see how to do a basic structural developmental assessment in children. So, what is development? So, development is the individual level of functioning a child is capable of as a result of maturation of the nervous system and psychological reactions. So, as the CNS matures, what and all is the child capable of doing at this certain age? So, they usually ask each other, no, is your child sitting, standing, walking, running at whatever age they reach? So, whether that age-wise related development has come because of the nervous system maturation. So it is the qualitative and quantitative changes in acquisition of a variety of competencies for functioning optimally in a social setting. So why does all this development be important? Because only when you attend all these, so attaining sitting, sitting without support, standings, walking without support. So these are the things you have to do at an age-wise at certain ages so that you become independent and you can function very well in a social setting, isn't it? Obvious. So what is assessment? So the milestone acquisition occurs at a specific rate and in an orderly and sequential manner. So there is a sequence in which all this development takes place. First this happens, then this happens, then this happens. So then that way assessment is important. Abnormalities can be a delay, deviancy, or a dissociation. So any developmental abnormality, it can either be a developmental delay, developmental deviancy, or a dissociation. So there are some principles of development. So how does the development take place? So it is a continuous process starting in utero and progressing in an orderly manner until maturity. So development is not something which takes place only when we are in, once the baby is born. It starts even when the baby is in utero. So initially it becomes an embryo, becomes a fetus becomes into a 3 kg almost baby is entered with eyes, nose, ears. Baby starts moving, the baby responds to the sounds which are made outside by the mother, etc. So all that we tell, no, so babies can hear what we tell, this what we tell. So that is also part of its development, what it does, trying to swallow, suck, and all that. Okay. So it depends on the functional maturation of the nervous system. Obviously, the nervous system which is important for all the development to take place in a normal manner is the CNS. So CNS functioning and maturing in a normal way is important for these milestones to attain. Next point in the developmental what to say sequence is the sequence of attainment of milestones is the same in all children. So every infant will babble before they speak in words and sit before they stand. Obviously. So you cannot say that my child was lying down and suddenly baby started standing and walking. Okay. So children do the same things. They first get head control, then they start rolling over, then they start sitting, from sitting to standing, standing to walking, walking to running, running to hopping. So it takes place in that. So that is the way by which it goes. So some children will do it so that you might feel that one step might be missed in between, but still it goes in that order. All the main things always happen. Again, if a child has to talk in words, initially they make sounds. So the sounds does not come that they can speak. The process of development goes in a cephalocaudal direction. That means from head to toe, cephalocaudal. So the head control precedes the trunk control, which precedes the ability to use the lower limbs. The control of limbs proceeds in a proximal to a distal manner. So first head control comes only when the head and the neck becomes proper. The rest of the body slowly starts to come in line with it. Okay, and the control of the limbs proceeds in a proximal to distal manner. So initially the big parts like the arms and the thighs, they all go help in rolling over, help in sitting. Then the fine movements. like trying to hold something, grasp with the fingers, the distal parts of the limbs. Those things start developing. Okay. And certain primitive reflexes have to be lost before certain relevant milestones are attained. Okay. For example, what you have to know fewer primitive reflexes. So one example is a palmar grasp. So what is palmar grasp? So in newborn babies, if you hold your finger against the palmar region of the baby will just grasp it like this. Okay. You must have seen in small babies when you keep your finger, they hold on tightly. But only if this is lost, the child will be able to open and close and voluntary grasp something if they want to. So later, if I want to catch this ball, catch that. If I hold everything which I'm going to catch, how will I be able to open and release and take what I want and go? So this palmar grasp primitive reflex has to be lost so that this voluntary grasp reflex is attained. And again, asymmetric tonic reflex. So what is this reflex? This means when you turn the head of the child to one side, the side to which I'm turning the head, let's say I'm turning to the left upper limb and lower limb will be extended, and the right upper limb and lower limb will be flexed actually. Okay, but in case I want to turn over, uh, if you put your suppose they want to turn over to the left, imagine you're putting your hands and left hand and left leg out like this. How will you be able to turn over? Only when your limb goes inside, you'll be able to turn properly. So again, this reflex has to go for the rolling over milestone to be achieved. So these type of small primitive reflex have to go for the next ones to go. So persistence of primitive reflex is also a problem in development. That's what we need to say. And the initial disorganized mass activity is gradually replaced by specific and willful actions. So initially you try to catch something, let's say they're catching with both hands this way, that way, just trying to grasp, you don't know which way it is properly and all that. But later, yes, I know exactly where the pin is, exactly where the point is, and I know where to point and where to go. And yes, I want to take that chocolate, I want to take that biscuit. Know exactly to go and catch that. Before that, we'll be going there, trying to go near, hitting, butting, using which hand, what hand I might class, may not class. But later, yes, I can know, I do it, I can take it and put it into my mouth. So these are the things. So now I hope you understood the main six principles of development. So it is cephalocordal, it is from mass these to smaller ones, it is from primitive reflexes have to go for this to come, isn't it? So it goes at the same rate in all children, I mean the same order. Okay, the rate is different, but it's same order which is following in all children. And first mass movements, then the final movements. And yeah, okay. So they are the main points you should know. Now coming to the factors which affect all this development. So you'll have prenatal, natal, postnatal factors. Prenatal, which occur before the development, the baby is born, or antenatal factors mainly. One is genetic. There can be a genetic disorder which affects the development. Maternal factors, maternal nutrition, exposure to any drugs or toxins, and maternal diseases and infections like torch infections. So they are also important. Neonatal risk factors, prematurity, perinatal asphyxia, and intrauterine growth restriction. So these are again the birth factors which will maybe hinder or alter the development of the baby. Post neonatal factors. After the baby is born, again, some environmental toxins, an acquired insult to the brain can be a trauma, it can be meningitis, can be encephalitis. Uh, then any deficiencies, it can be vitamin, mineral, nutritional deficiency, infant and child nutrition, iron deficiency, iron deficiency, or any infectious diseases. So again, if the child is affected by many infections or infectious diseases, this can also alter the development of the child. Psychosocial factors. So besides the antenatal, natal, and postnatal factors, what are the remaining factors which help to decide the development of the child? One is obviously parenting. So if the parents do not practice positive parenting, they do not help or encourage the child per se, family situation is not good, or there are some conflicts or fights among the parents itself which they are not taking care of the baby. These also will help to these all will affect the baby's development also per se. The baby will not get that positive vibe or good environment to grow up in. Poverty, yes, they might not be able to give good enough nutrition to the baby. Lack of stimulation. Again, you are not, you are too much self engrossed in yourself, your own work is that You do not spend time with the baby to help to do the next thing. You do not put the baby on a mat, you do not massage the baby, you do not talk to the baby all that. Violence and abuse, maternal depression, and institutionalization. Institutionalization generally means what to say, putting in some theories to themselves, like generalize it all this way, that way, all that, and not trying to take care of the baby per se. Our child is different. Every child is different and unique. Instead of seeing that, you're just putting it all in the same club. No, it's like that. No, Arpita, the kids will be like that only. It will be like this only. Don't bother. So that way, you're not giving special attention to your own child. What are the protective factors which will surely help development? Breastfeeding, maternal education, obviously. So with all this, now we're going to know what are the main developmental domains and how you assess them. So I guess you know, hopefully, what are the main developmental domains: gross motor, fine motor, language, vision, hearing, and of course, social and personal. So gross motor, as the name suggests, stands for gross movements, so the mass movements which the child or baby does. Fine motor, finer, smaller things using the fine distal muscles like writing, scribbling, and all that. Okay. Then personal and social development, obviously how the interaction with the other children, other people, and all are. Then language, how the child talks. Then finally it is vision and hearing. So what are the three cross-motor developmental milestones? As I said, they are referred to the big movements. Okay, so you cannot mug up everything as I tell you in a class. This has to be repeatedly read. Please go through videos also on YouTube showing about all this milestones and all that. So repeat. You can see these videos which we are making also. You can keep seeing them repeatedly, and so that you will keep on getting a hand of how the child grows up. Okay. So as I said, if you know the basic principle that it starts from cephalocaudal. Okay. So that itself will help you to categorize and write down. Okay. So as I said, so it should go from head below. So neck holding is the first milestone to be attained. So the head should be straight. Child should be able to look around this way and that way. So that is the very important. It is attained by 3 months. Next, by 4 to 5 months, when this asymmetric tonical reflex is going, so we go down to the trunk. So neck is steady now, now going to trunk. And when trunk is steady, this is gone, child starts rolling over. Next is 6 months. Once you know to roll over this way, that way, what's going to be the next thing? Coming down more down to the hip. So it's in a tripod fashion, sitting with the whole support. So sitting in tripod fashion means using arms to lean forward and sit, okay, with own support. This happens by 6 months. Once child sits with own support like this, and slowly the child will get more strength and more I can sit properly without putting my hands and leaning forward. So that occurs at 8 months. Next, once you know to sit very well, the next option is now using going down the muscles going down. We came from head, now we reached up to the trunk down. Now going the legs. So standing, holding on with support, which occurs at 9 months, and then standing without support again, which occurs at 12 months. So when the child learns to stand without support, what other thing happens is creeping is something which happens. So creeping refers to the walking on all fours, okay, bear walk, okay, and also child can try to walk this time, but child will automatically fall. But by 15 months, this will get uh, practiced and accustomed when child starts walking alone by 15 months. Okay, and child can help can also crawl. I mean, go on all fours upstairs. So like a small bear or cat or dog, how they climb up, they'll be able to climb upstairs also. By 18 months, they start running. So walking is now been achieved. Now it can do it faster. So they start running and also they start opening and closing drawers. So the upper limb extremities are also used well there. By 2 years, the child can walk up and down stairs 2 feet per step. So that is also important, that balance. So first he needs to keep two feet, 2 feet on each step and going up and coming down. Okay, jumping. Child can start to do. Once you know to walk and run, the next thing you try to do is jumping. By 3 years, child starts riding a tricycle, and then before they using 2 feet to go stairs upstairs, now they can slowly know, yes, I can keep 1 feet after the other like my mom and dad. And by 4 years, so initially they learn how to go up because they don't have to look down and get scared. So going up is easier first. So that comes first. So tricycle has 3 wheels, which comes at 3 years. Thing. Hopping by 4 years and then coming down one step per 1 feet first step. So as I said, I told you, walking like a bear is called as creeping. You can see here in this picture. So this usually comes by 12 months. So before creeping, what the child going to do is crawling. So crawling means, even though we tell crawling, crawling, but the child going on all fours, crawling actually means the abdomen is touching the floor or the surface. So A in crawling is a mnemonic which we use where A means abdomen touches. So in creeping, there is no abdomen. There is no A, so the abdomen does not touch. Get it? So that is about gross motor. I hope you remember now. So from head, roll over, sitting, standing, walking, running, hopping, climbing upstairs also. In between this crawling and creeping. Good. Now going to fine motor development milestones. So fine motor developmental milestones are the smaller things which we use our uh, fingers and all the distal muscles and all we use. So first thing which we try to do, as I said, once you get off the palm or grasp and all, once you start doing a voluntary reach for things. So initially I don't know that I how to reach for things, so I try to use both my hands to reach. So that occurs at that's called as a bidextrous reach and what is that 4 minutes. Then I know I don't have to use two hands to reach out for an object. I can take a single hand tool. So that is called as a unidextrous reach. And I can also transfer things from one hand to another. So transfer of object. So these both occur around 6 months. Next, once I can transfer hand to hand, then I start finding out, yes, I have got further fingers. I don't have to use the whole hand either. I can take up things with fingers. So that trying to take up like this is called as a pincer grasp. So by 9 months, it doesn't come properly. It's a immature pincer grasp or probing with finger like this. But at 12 months, this becomes very well, and you can take things directly, very well like this with two fingers. That becomes a mature pincer grasp. Once I know I can do things like this, hold a pen, pencil, and all like this, then I know that using that pen and pencil which I hold, I can start scribbling also. So 15 months, scribbling comes. Also, I can take blocks with my fingers using the pencil grasp, and I can make a tower of two blocks, one on top of the other without falling. When I reached 18 months, I can scribble myself very well and make a tower of three blocks. Then, from 2 years onwards, regarding towers and value of easy mnemonic, for 2 years it is 2 into 3, 6 blocks. By 3 years, it is 3 into 3, 9 blocks. Okay. And by 4 years, you can make a bridge with the blocks. Like you can give two blocks and another block in between that by forming a bridge. And so this is regarding blocks. So what else can I do? Initially, I learned how to scribble, isn't it? Then by 2 years, I learned, yes, I can do straight lines. It can be a vertical line or a horizontal line. And start circular strokes also. By 3 years, I can make a proper circle. By 4 years, it becomes a cross. I can intersect two lines and make a cross. And by 5 years, it is a rectangle. So these shapes are usually questions which they ask you. So if you remember it in this way, how this goes and how this progresses, it becomes easy for you. So as I said, so by 4 years, so you can start and try to give a building a bridge. So that usually comes here, I said, no. So 3 years, number of blocks is 3 into 3 is 9 blocks. I can build a straight tower. Or by 3.5, 4 years, I can build a bridge like this, one on top of the other. Next thing is building a gate. So if I keep the blocks straight on top, allowing something to go underneath the bridge. So this is a gate, but I keep it diagonal. There is a little more skill, isn't it? And then after that, see, at 5 to 6 years, building steps. I know which is shorter, which is taller, which is bigger. So I can go that way. Pencil test, as I said, 3 years is a circle, 4 years is a cross. Next is a square. Okay. After a circle, usually 4.5, it's a square also. And 5 years, they can learn to draw a triangle. So we have finished gross motor and fine motor. Let's go into the next one, which is social and adaptive. So this is also important. This is how the baby converses with other people, converses with friends later, converses first of all with the mother, father, and other people in the family, interacts with strangers later, and then interacting with known people also. So all that milestones is also something which you have to develop. Then only you can be a socially sound person, isn't it, in the society. So what is the first thing that comes is a social smile. So from the time the baby is born, people keep looking at your mother especially, and everyone keeps looking at the baby, smiling, smiling, talking, telling you're so cute, this, that, etc. First thing that the baby notices is that everyone's smiling at me, so I also start to smile in response. Okay, so that itself is a very important milestone. Not attaining social smile is a very serious incident. Okay. So after that, I start smiling, everything. I slowly, first person recognize is my mother. So I'm looking at my mother who's feeding 24/7. So obviously, the first person I should find out is my mother. So recognizes mother at 3 months. Also anticipating feeds. Now I know when I'm hungry, etc. When mother is going to feed me, etc. At 6 months, by 6 months, the baby starts finding out who are all there in my house and who are all away from the house. So stranger anxiety should start to develop usually. 9 months, the baby starts waving bye bye. At 12 months, by 12 months, what does the child do? Cross motor and fine motor. Cross motor child can stand without support and also start to walk but fall, isn't it? Also, this time the child baby also starts getting a mature with a crust and tries scribbling and all of that. So at this time, usually they know their name also. If you call them baby or whatever you call them at home, they come when they're called. They can even play a simple ball game. You throw something, they know, yeah, we have to throw it back. Whether they do it or not, that is supposed to be done, they need to understand. By 15 months, he starts speaking in jargon. So jargon is nothing but that baby language, or blabbling baby language. Is very cute to listen and hear, isn't it? Which we don't understand at all, but they keep on talking. So that is called as jargon. At 18 months is the time they are exactly our little copycats. So mother tries to sweep, baby tries to sweep. While we do laundry, they do laundry. When we pick up something we arrange, they try to arrange. Whatever cooking, they try to copy and all that. So copying is something they like to do. 2 years, they ask for food, drink, trying to go to the toilet most probably. Toilet training to an extent will come. And also they like something they want to show us, they pull us to show them what the things like. You know, see this, see that, look at this, look at that, and all. By 3 years is the time they start going to LPG. So they then they know their name, gender obviously, and also they start learning about sharing. Okay. 4 years, playing by 4 years. Next, by the time you'll be in UKG. So imagine in that way. So plays cooperatively in the group and goes to the toilet alone. So no, yes, I know if I have to go to the toilet, this is what I should do. By 5 years, child also helps in small household tasks like go keep the plates on the table, go keep the glass there, go do the, can you wipe this plate, all those small things and all they will help you. And they will learn to dress and undress also by themselves. So that's nice, no? See all the milestones are coming together, isn't it? So once the social part, so you see how all these are important to become a socially important person. So next is language milestones. So language, as I said, when social smile comes at 2 months, alert to sound is the first milestone again that comes. So when mother speaks, so baby is crying so loudly, but when mother tells, shh, calm down, baby, you know, my dear, is that baby calms down. And again, when something happens, the baby startles again, hearing a loud sound. So that sound alertness and sound response is the first and the first very important milestone. And only when you hear, you can communicate, isn't it? You can't hear how you keep talking by yourself. So that is why alert to sound becomes one of the most things in a language milestone, and that comes by 1 month of age. Next is cooing. So once the child starts making sounds, the first sound you do like a musical sound is called as cooing. Here, usually the first sounds the baby makes are usually vowels. Okay, then A, E, I, O, U, A, U, these are very common sounds that they can make properly. So that is why that comes first at 3 months. Next is laughing aloud. So once I know, okay, make sounds, this that social smile would have come back in by 2 months. So after social smile, next is laughing aloud. So the whole smile they show that toothless smile full of vigor and they laugh. Okay, they can giggle when you try to tickle them, when you make sounds at them and all that. Next at 6 months, the first they start single words like ba, pa, da, a, gu sounds and all. Okay. So monosyllable. So first the ba, pa, da comes separately. Ba, ba, no. By 9 months, we can combine those monosyllables together and become by ba, ba, da, da, ma, ma. So it's double now. So it's a bisyllable. By 12 months, 1 year, they have 1 to 2 words in their vocabulary, like and something like it can be water, something, papam, something whatever you use at home. Okay, some 2 3 words which are very common to them, they will be having them. With meaning, they know what it is. Okay, and by 1.5 years, that vocabulary just becomes like almost eightfold or tenfold. So you have an 8 to 10 word vocabulary. They know few things. Maybe it is their dress, their towel, something like the fan, their shoe, the water, bottle and all that, but they might not be clear, but they have the vocabulary, they know what it is for. By 2 years, they even use 2 to 3 word sentences like Amma, give me water, small things in their own language usually. Amma, Anita, okay, or something. So what else? Pammenam, something like that. So whatever they want to tell, they can use, and they can also use me, you, uh, and also third person things like Amma, who is he, who is you, and all that he will be able to know. By 3 years, of course, again, as I said, it's time to go to LKG. So they know name and gender. We'll start asking questions also. What happened? Why is this? Why is that? That is that inquisitive nature. They keep asking what and why for everything. And by 4 years, they can sing songs or poems or tell stories. Obviously, LKG kids will do that. In 5 years, they start even asking for meanings of other words too. So these are the four major development milestones. So besides this, I said two things are important: vision and hearing. So hearing development, how do you look for? So hearing is only usually starting in utero itself. As I said, babies can even hear the sounds from outside their mother's womb and all that from before birth. So probably 6 to 7 months of time. So usually to make sure development is normal, there is a brainstem evoked respiratory. Sorry, Vera is a brainstem evoked response. Okay, audiometry, which is a hearing test done at birth, usually along with an OAE, which is an acoustic emission, which is a screening test. These both are usually done at birth and within 6 weeks to make sure that child's hearing is good. Ability to hear correlates with ability to pronounce words properly. As I said, if you can hear properly, the better will be the speech output and language. Again, you have to ask the history of recurrent ear infections or arthritis in India. And if you have any, if you very in the screening test, you have to repeat hearing screening test and confirm it and get a speech therapy also if needed. If it is not a hearing problem, it is only a vocabulary problem. See, for example, orienting themselves is a small test which they do with the sound of bell. So initially, if I ring a bell, okay, see for the same child at different ages, the bell is rung at the same place. So at 3 to 4 months, the child just turns the head to the side of that, okay, little this way, that way, doesn't know exactly. At 5 months, it is a full 90-degree view with that direction properly. At 7 months, it is looking this way, it looks straight and then a little bit up. It doesn't know to directly have a diagonal vision. But around 9.5 months, this you can easily focus to the sound here, sound here. Okay. Otherwise, it is like this, it is somewhere, somewhere, then directly it is there. Next is assessment of vision. Okay. So vision is usually done by putting a red ring or some a bright color in front of them and see how they respond to that sound. So a newborn will be able to follow this red ring for a 45-degree average. So my head is straight, they turn 45 degree. That is what has happens in a newborn. By 1 month, it follows till 90 degree. 3 months, 180 degree. 4 months, 360 degree. This side and that side. Okay. Then again after 3 to 5 months, when the child's grasp and all starts, when the child looks at its own hand like this, hand regard comes. So the time when you start this unit extra grasp and all I told you. So that is also important. And then by 5 months or 6 months, when child is going to like start complimentary feeding, so seeing how food is prepared, all these colors, the fumes coming, smoke coming, and all that excites them also. Okay, so that is the general development milestones we all saw. So we saw all the main milestones which are from 3 months, 1 month, 2 months. So newborn period milestones development again is important. So how do you assess the newborn development milestones? So 0 to 6 weeks. So there are there's a 180-degree flip test which we do. Okay, that means first you child is lying down like this. You assess the child in supine. You pull the child to sit. Okay, see how it is sitting. Then you pull the child in a ventral suspension by suspending under the axial region. Then put the baby in a prone position also. Okay. So this way. So one again back to lying down. So 360-degree, 180-degree flip test is called. Okay. From this position to this position. So let's say from supine we are pulling the baby to sit. So from first 1.5 months, what happens? There is no head control again. So there's a complete head lag. The back appears around it. Okay. At 6 weeks alone, the head control slowly starts to begin. So when I suspend the baby ventrally, the head flops down, and by 6 weeks, it momentarily tries to hold in a horizontal plane. So can you see pulling to sit here? and the head flag is there behind, completely head flag. As the child grows older, can you see the wing becomes a little compared to the previous one and this one? Can you see the head flag difference? You see this video I wrote. See the head flag in the newborn baby and the little. Let's see. So this baby is almost above 6 weeks now. Seconds, yeah. So that is baby has reached almost 1.5 months now. Now at 8 weeks. Okay, 8 weeks means 2 months. Okay, so again, at this time when you put a baby in ventral suspension, the baby can maintain the head in line with the body. And prone position, when I put the baby down like this, prone head is facing down, the baby head is lifted up to 45-degree angle. And this is the time when I said 2 months is there, social smell comes and alert to sound also appears. Now at 4 months, see from there how the baby has come up. So when you put to sit, the head is steady now. It continues up to 3 months. Prone position, the head, face, chest are all above of the couch. Ventral suspension, the head is above the plane of the trunk. Okay, and fine motor, 4 months bidextrous approach. Can you see? Child is holding two hands, child is holding a doll. 6 months now. So 6 months, as I said, we put the child prone. The child can lift the entire chest and the upper part of the body itself away from the base of the bed. Sitting with support tripod and holding a cube unidextrous uh, grasp as cup. 8 months. 8 months child is sitting happily without support and grasping objects from the radial aspect of the hand. So initially there will be bidextrous grasp as I said, then unidextrous grasp, then trying to catch with the fingers, which side, this side, then pincer grasping up. 9 months, the child is standing with support. See, immature presence grasp will be there, waves bye and says bye syllables. See, the child filming the pincer grasp from immature. See the picture, 7 months, 8 months, 9 months, and 10 months, how the baby is. Also, the immature pincer grasp usually appears at 1 year. Peekaboo. A child's ability to know that an object continues to exist even when it cannot be. So we feel so this again comes only by 9 months. This is called as object permanence. So before that, if you hide something from the child doesn't in front of the child only if you put it under a cloth or a screen, child doesn't know that the thing is still there. Child thinks the thing has disappeared. But after 9 months or so, the child will know yes, okay, this is sit on the towel, it slowly starts to search somewhere under. Then at 12 months, the child stands with support. Uh, as I said, child can stand with support, walks alone but falls, can stand without support, sorry. Mature brings a glass from 1 to 2 words with meaning. 18 months domestic mimicry. 2 years walking up, as I said, 2 feet per step, pulling people to show toys and telling few sentences. 3 years tricycle, copying the circle, 9 blocks, nose, name, and gender. See, change is drawing the circle here. 4 years hopping, group play, says a poem and calls it no class. 4 years alternate feet, yoga. So this girl is copying very happily. She can draw a rectangle and also copy a cross. 5 years, almost everything has come down. Skipping, copying a triangle, undressing, dressing, asking meaning, and identifying colors also. Okay. So these, we had a good revision of everything. So I hope you're all clear with everything. Now, I said there are some milestones which are very important here and red flags also. Okay, so these things have to be attained by this month actually for the remaining development to do well. One is visual fixation. So some fixation to an object at least should have come at 2 months. Following this rendering and all, should be able to fix on an object rather than usually this will not be have very hard fixation will not be there. So that usually comes by 2 months, which is very important for visualization. And some vocalization should have started by 6 months. Sitting without support at least by 10 months, standing with support at least by 1 year. Okay. With support at least they should be able to stand. Crawling, hand and knees crawling, they're just creeping at least till by 14 months, standing alone by 17 months, walking alone 18 months. So that is upper limit of walking alone. At least by 1.5 years, the baby walks alone, it is good. Then single words by 18 months and imaginative words play by 3 years. So what do these red flags indicate? Red flags indicate that development is seriously disordered, the child should be referred to a developmental community pediatrician. So other than that, as I said, what are the other things you should see? You said no, sit unsupported by 12 months, walks by 18 months or 2 years in children, walking other than on tiptoes, running by 2.5 years. These are things a child cannot do at least by this time. Object placed in hand by 5 months, reaching for objects by 6 months, pointing and to share objects by 2 years. And other things you have to take care of, loss of any milestone at any age. This is the child has achieved all this, but now it is going back. That is again very important. Okay, vision problems again, but it is hearing problems, no muscle tone of floppiness, no speech by 18 months, complex disabilities or head circumference being high or low. So as I said, so these are the things you should take care of. Early rolling or either early or persistent delayed things are very important for each age group. So again, I've given this in each age wise, so you can go through this again. So in short, that's what I said: hypotonia, visual motor defects, attachment problems, and all that. Absence smile again for 6 to 12 months. But primitive reflexes are still persisting. No talking by 6 months. No stranger anxiety by 7 months. Not able to localize by 10 months. All that. And then by 2 years, no consonant production, lack of imitation, no hand dominance too early. Usually by 3 years only, child will come to handedness. Okay. So again, you have a chart like this usually, which is there in your OP guide textbook also. This is a development assessment chart given by the WHO. So they have given a window frame in which each of these main things should come: sitting, standing, crawling, walking, standing, walking alone. So when the child comes to you, you can plot it there when they come in whichever months. Suppose the child is coming in several months and you can ask them. So if this is done at this age, within this window period means it is normal. Okay. So these are the things which we can usually check. Object permanence, as I said, imitation, color and shape recognition. So how do you check all this? As I said, with one or both the parents, but no prompting or helping in a room with all appropriate toys. Look at the interaction of the child with attendants and also how the child does everything. Look for visual and all assessment too. So also ways to look for physical growth, other comorbidities, any systemic deficiencies also, and also health circumstances. So as I said, as we saw what and all we are doing, see, you need a paper, we need a pencil, we need a rectangle permission, we need a paper pellet, spoon, dolls, mirror, and all that, isn't it? So see, this is one example of a developmental screening test. Okay. So we ask the child to draw a man. So depending on how much the child can draw, we give total points. So head alone 1 point, legs alone, head with legs this much, head with legs and arms this much. Trunk also, length of the trunk is more than the breadth. If they know to do that properly is one. Arms attached to the trunk, legs attached to the trunk, neck is drawn, eyes are there, nose are there. So totally there is 13 points. Okay. So the mental age is 3 into 3 plus 13 plus divided by 4, which is 6.5 years. So this is how we calculate. Okay. Now how many points they have drawn? Divided by 4 plus 3. This is a Trivandrum development screening chart. So there are many there. I showed you few names there. Patek Baroda screening test, Denver's development screening test, good enough training test, and Trivandrum. So this is the good enough drawing screening test. So this is one of the screening tests. So if the child's age is 8 or 11, but the child can draw only up to 6.5 years, it means there is a problem. Okay. So and on screen chart again, as I said, see they have given a list of things which the child should do in this one. So you, this is the normal range, whatever is given by you. So if you are for this child, try to assess all this and see whether it is coming in that range. So whatever falls to the left means it is less, and whatever falls to the right means they've attained it well. So with this, I hope you're all clear with what and all the developmental assessments you do, all the videos to see, and in screening. So when the child comes to your 2 years and 3 years, ask the relevant cross motor, fine motor, social, adaptive, and language to them. If there's a delay, try to see what is the delay and see what we can do for the child and what counseling we will do, what could be the cause, so that we can pick out the overall development of the child better. So see you in the next class. Thank you.